Hi, my name is Brad Siff. I'm the founder and president of BioWave. I'd like to welcome you all to our May webinar. I have the privilege of introducing our guest lecturer this month. His name is Chris Joseph. He is the athletic trainer for World Wrestling Entertainment, or WWE, and his presentation will be on the implementation of BioWave to decrease pain and facilitate return to activity. Before I introduce Chris, I just want everyone to know that we will have a Q&A session, a live Q&A session at the end of the presentation, and there will be a chat box at the bottom of the screen so you can enter your question so we can answer it live at the end of the whole presentation. So thank you very much. And with that, I would like to introduce you to Chris Joseph.
All right. Well, I want to thank Brad and BioWave for having me. I think I first met Brad in 2007 when I ordered a BioWave Pro unit for a starting quarterback with a grade 2 AC sprain on his throwing shoulder. And I've been using their products ever since. So this is my background. I've been an athletic trainer for about 20 years. My background is primarily Division I football, and then I've been an athletic trainer at the WWE Performance Center based in Orlando, Florida for the last 5 years. For treatment philosophy, I try to divide almost every injury we see into a short-term injury versus a long-term or surgical injury. So to me, a short-term injury would be something with limited to no time loss and limited to no immobilization, where our goal really is trying to quickly decrease pain and restore function. And the biggest part of decreasing pain there is by decreasing pain, we in turn decrease muscle guarding, we decrease spasm, and we improve neuromotor inhibition. Reduction in that pain signal allows for increasing motion earlier and improving function faster. Something that's been very, very helpful, especially with some of our short-term injuries, is the BioWave motion protocol. Especially in decreasing acute pain, getting somebody moving much faster. When we start talking about long-term or surgical injuries, to me, the most important thing is restoring patient comfort, so restoring their comfort to a pre-injury level. When I talk about long-term or surgical injuries, usually I'm talking about something with longer time loss or longer periods of immobilization or motion restriction. And something that the BioWave has done a really nice job with is decreasing post-operative pain. To me, a lot of this, I relate back to ACL rehab. If we're able to decrease some of that anterior knee pain faster, we're able to improve motion a little bit quicker, and we're able to improve VMO firing at a much more rapid pace than we would if they were still painful in the front of their knee. So protocol for using the BioWave is pretty standard. Apply the BioWave to the primary and or secondary pain site for 20 to 30 minutes. A lot of injuries, you have a primary pain site and a secondary pain site, and the biggest issue in the athletic training room tends to be time. If I have a primary and secondary pain site, I'm probably going to use the two different size electrodes if I'm trying to attack that in one treatment. If I have the ability and the time to do it in multiple treatments, I think that we're able to see an improved effect. The intensity is turned up to tolerance. So when I tell them I want it to be strong but not painful, and oftentimes I use the BioWave in conjunction with a lot of other modalities, whether it be heat, ice, game ready, Thermex, and I've even used it in conjunction with Normatec. Some people don't like that because they think that the Normatec squeezing on the electrodes can increase some sensitivity, but I really haven't had that same feedback from most of our talent. The biggest thing I would say is if you're going to use it in conjunction with a compressive modality, make sure the compressive modality is turned up first, because the compression is going to cause some increased pad compression on the skin, which is going to potentially cause some increased sensitivity. Our treatment goals are generally decrease acute, subacute, or chronic pain, increased duration of pain control compared to other modalities. So the BioWave, the patients seem to have a longer pain control effect from BioWave than they do with a lot of the other modalities that we use in the athletic training room. And by decreasing their pain, we're in turn able to increase range of motion and increase function. Some other things that we've been able to integrate into clinical practice, and this is probably something that's a little more specific to our setting here, since we have physicians on hand who will do minor procedures and injections, pre-injection and post-injection pain control. We've been able to use the BioWave to decrease some skin sensitivity prior to PRP injections, which has been especially helpful, especially with some of our musculotendinous PRP injections. The other thing that we've seen is some decreased sensitivity and tenderness to palpation prior to dry needling and manual therapy. And, you know, the biggest thing, the nicest thing I think that BioWave has come up with in the last almost 20 years is they've been able to decrease the size of their units without changing their waveform. You know, so we went from having a large blue box that was super rigid and super durable, but was kind of a bear to carry around, to a stim unit that goes into my pocket or clips onto my belt. So I'm going to get into a couple of case studies right now. First one is an acute medial gastroc strain. So several of my case studies are revolving around WrestleMania. For WWE, WrestleMania is kind of the culmination of a year's worth, sometimes multiple years worth of storylines. And it's also an event that, because of the publicity involved, sometimes the wrestlers will get an increased payday out of it. So because of that, it's kind of like getting into a sport postseason where these athletes are going to push through just about anything to try to get on the field and get back to doing what they need to do to perform. So this individual felt a pop in his left calf during a match. He had a mild palpable defect with a previous history of bilateral calf strains. So it's unsure as to whether this palpable defect was acute or chronic at this point. Differential diagnosis was an acute medial gastroc strain versus a plantaris rupture. And he was given a cam walker and crutches to be able to leave the building that day, with some pretty significant increased pain later that night. Had an MRI the next day that revealed an isolated gastroc strain. And again, like we just talked about WrestleMania, this injury happened 3 weeks prior to WrestleMania, where this individual had a career match planned against somebody who was one of his idols, role models growing up. And he was in the middle of contract negotiations. So this was a must-happen match for him. As a result of the acute medial gastroc strain, he ended up having a 3 cc leukocyte-rich PRP injection administered under ultrasound about 3 days post-injury, and was non-weight-bearing in a cam walker and a knee scooter for about a week before we started to be a little more aggressive and advance his rehab. So we began using the BioWave the day after injury for him, and the biggest thing was pain control, because if I can control his pain, I can increase his motion. If I can increase his motion, I can decrease some adhesion, while still allowing that medial gastroc to heal, as long as we're not straining it and stressing it by doing strengthening. So he was using the BioWave unit with the B set pads here in the athletic training room, and he was given the calf wrap at home. He really liked the calf wrap just because it was idiot proof for him. There wasn't a whole lot of thought that went into it. He just wrapped it around his leg and he went. About 7 days post injury, he was non-weight bearing, out of the cam walker during rehab to try to increase range of motion and do some light ankle strengthening. In order to gradually increase his activity over the next 2.5 weeks, we used a combination of Alter-G and pool. We were doing rehab about 7 days a week to try to get there. To me, I think the 7 days a week is probably more of a placebo effect than anything. But I think the fact that I had my hands on him every day made him feel better about the whole thing. And ultimately, this individual was able to complete a 30-minute cage match without any increase in symptoms, with his calf taped the way you see in the picture. 3.5 weeks post-injury. He ended up being able to take about 2 weeks off after that match and had no more symptoms following the rehab for this, following the recovery. Next case study, to me, this is probably one of the most common and most appropriate uses of the BioWave. Grade 3 AC joint sprain. So this individual landed on his left shoulder during a match. It was able to complete the match with a modified finish, but had a visible defect and visible tenting of his left AC joint. Positive spring and positive crossbody test. Was placed in a sling, and X-ray and MRI were ordered after the show. 2 days later, X-ray and MRI were completed, which showed a grade 3 AC sprain, and he opted for non-operative treatment of this and ended up having a pretty good result. Again, some of the pertinent patient information for us is that he was very motivated because he was in a contract year. So he was immobilized in the sling for roughly a week, and then we started some rehab. Rehab really concentrated around glenohumeral range of motion, primarily using the BioWave motion protocol and some scapular control exercises. He is somebody who did not have great scapular control prior to this injury. So scapular control post-injury was a priority for us. We were able to restore full pain-free range of motion about 4 weeks post-injury. He began light upper body lifting, including some pressing, in pain-free ranges at about 4 weeks post-injury. And he was actually able to return to matches on television about 7.5 weeks post-injury with a grade 3 AC sprain. And we used some clavicular strapping to try to make him more comfortable initially. And I believe at about 10 weeks, he stopped using the clavicular strapping. And this was about 2 years ago, so he's had no issues since. Third case study, this one was a lot of fun. Young man is over 7 feet tall, weighs roughly 380 pounds, and felt a pop in his low back while he was lifting. Immediately had left side low back pain and difficulty with trunk flexion, and immediately had radicular symptoms down his left leg, primarily into left lateral low leg and left foot. He did this lifting at home, and we finally saw him in the athletic training room about 4 days post-injury with altered sensation over left lateral low leg, left dorsal lateral foot. 4 out of 5 L4 nerve strength, 3 out of 5 great toe extension, so L5 strength, and an absent Achilles reflex on his left side as compared to his right. So MRI findings showed a pretty significant L4-5 disc extrusion with some foraminal narrowing and some pretty significant nerve compression. So we immediately opted for a lumbar epidural steroid injection. And again, WrestleMania comes into this for us because this young man had again, career match planned on the biggest stage with somebody that he looked up to for a long time growing up. And we had 4 weeks to get him there. BioWave, again, was implemented 4 days post-injury to control his low back pain. Because he is such a large individual, we had to really concentrate on some hip mobility, some thoracic mobility, and core stability. We used the BioWave multiple times a day for the entire first week to try to control that lumbar pain. And then daily in week 2, as we started to progress his activity, he was one that, again, was very motivated. So we were able to progress reasonably quickly, and he was able to work through a lot of different things. We were very fortunate because he had such a positive effect from the lumbar epidural steroid injection. This is actually this young man's MRI on the right side of your screen, and you can see on the right side of that MRI just a almost complete closing of that left side foramen. Without that positive effect of the epidural steroid injection, I don't think that we would have been able to get him there. But at 4 weeks, he was able to return to full activity with 5- out of 5 great toe strength, 5 out of 5 left foot dorsiflexion strength, and a significantly improved Achilles reflex. And because of the BioWave, we were able to get him moving a lot faster than I think we would have otherwise. This individual, this was a year and a half ago. And this individual has had no issues since then, and his Achilles reflex and great toe strength have actually returned completely to normal at this point. This one is probably a little bit more common in the athletic training room, especially when we're talking about wrapping up a season. So this individual had a chronic medial meniscus tear. We knew he had a chronic medial meniscus tear. He was asymptomatic and hadn't had a flare in about 2 years at this point. But he had an acute flare with swelling and pain about 5 weeks prior to a WrestleMania match, where he had multiple parts and was supposed to be heavily involved over the course of 2 days. So MRI confirmed the chronic meniscal injury that we knew about. Good news is there was no additional injury along with that. So the BioWave was used on a daily basis, again, for pain control and to facilitate increasing motion. And again, we use the BioWave in conjunction with many other modalities. Game Ready Normatec for decreasing pain, decreasing swelling. We did a lot of strengthening with him to try to keep his VMO going. Increase hamstring flexibility, increase hip flexibility and hip mobility, just to try to do everything we could to take stress off of that posterior medial knee. And this individual was able to complete a 25-minute match at WrestleMania without any increase in symptoms. And then he again had a pretty significant role the following day at the second day of WrestleMania. He ended up having a partial medial meniscectomy about a week post-show, which was something that, was planned prior to this flare, but I think the BioWave was really essential in trying to help us get there. Another case that I actually just used the BioWave on prior to getting onto this webinar today, have an individual with some pretty significant cervical facet dysfunction. We were able to use the BioWave to decrease some pain. By decreasing pain, we were able to facilitate motion and decrease some spasm. And then I also made him significantly less tender for me to be able to do some PA and UPA cervical lobes. And he left feeling significantly better than he did when he walked into the room. So in summary, BioWave is proven to be a highly effective modality for pain control. It's a beneficial modality for acute, subacute, chronic, and surgical pain. It's something that we use daily in our athletic training room for a variety of patients, whether it's an acute injury, a chronic injury, something that's a mild subacute flare, or our postoperative patients. It has a lot of applications that can directly impact the effectiveness of other interventions. So like we talked about, decreased tenderness to palpation prior to manual therapy, decreased skin sensitivity and tissue sensitivity prior to dry needling, and decreased pain and sensitivity prior to some injection or injectable therapies. I think the technological development to decrease the size and price of the modality is really huge, and it makes it available to so many more demographics and populations. And BioWave has proven to be an essential pain control modality in any athletic training setting. This is something that in previous settings and previous jobs, and still here with WWE, I'll send a talent to meetings with a unit, decrease their symptoms, decrease their pain, allow them to get in the ring and get done what they need to get done for the day. Kind of the same as a football practice field. send them to meetings with the BioWave prior to activity. They go out and practice. They come back and do some rehab afterwards. And we've seen some lingering pain control effects. With accumulated use, you're seeing more beneficial effects and longer lasting effects. Thank you all for your time. This is our staff at WrestleMania 40 this past year and my family. So thanks, everyone.
Chris, thank you. That was an awesome, an awesome presentation.
Appreciate it, Brad.
Greatly appreciate your time for this. So, everyone who's listening, if you have any questions, please submit them to the Q&A button at the bottom of the middle of your screen. We do have actually a number of questions that have come in. So I'll tee them up for you, Chris.
Sure.
So I I hope this first one doesn't put you off. So the question is, do the athletes actually get hurt in WWE since it's choreographed?
Yeah, and this is something we get a lot. The injuries we see with WWE are actually really similar to to any other sports setting. Yes, it's choreographed in terms of, they know kind of what they're going to do when they get out into the ring. But at the same time, the stunts are real and the falls are real. And I've seen everything from, your chronic patellar tendonitis that you see in any other sport to a multiple joint dislocation on one person. We like to refer to these guys as essentially stuntmen. They're really athletic stuntmen. So yes, the injuries are real, and we see a lot of them.
Thank you. Next question is, well, you kind of answered this. What type of injuries do you typically see?
Yeah, we see, like I said, we see a lot of the same stuff that you would see on pretty much any sports team. We had a run of ACLs not too long ago. I think the most interesting thing is that's biggest difference between WWE and other sports settings is everything we do is on an unstable surface. Because the ring is padded and it's got a thin pad on it, and it bounces and rebounds underneath of the person. So it's almost like running on a spring floor all the time.
Next question, how do you keep the pads on while using the BioWave movement protocol? For example, do you ever use cohesive wrap as an example?
Yeah, I do. I use ACE wraps. I'll use cohesive wrap. I've even used cover roll if I have somebody who's doing a little bit more aggressive motions. But I use the BioWave movement protocol for a lot of different things. And hey, I'm very fortunate where, for me, I can kind of spend money as much as I feel like money needs to be spent. So I've actually started using some of the percutaneous pads for movement protocol as well, and had some really good effects with them. Basically be creative. However you can find a way to keep the pads on. The other thing that's really nice is the regular pads for BioWave. If they do start to lose their adhesive ability a little bit, you just pre-wet them with some normal saline. And a lot of times that tackiness will come back. So the pads will live a long time on the BioWave compared to some of the other electrical stim pads.
So you mentioned the percutaneous electrodes. Do you find that the efficacy is better for more severe pain conditions and or last longer as well post-treatment?
I have. The percutaneous electrodes are a little bit more expensive, and the downside is that they're single use, so you can only use them on one patient. But if you have someone with chronic pain who's going to continue to use them over and over and over again, I think it's worth spending the money. We have seen some. I had somebody about 2 weeks ago that, we tried the regular pads, had some good effect. We tried the percutaneous pads, and essentially he used the machine once a day instead of 3 times a day with essentially the same effect.
Interesting. That's we receive that type of response. We've heard that type of response before from other providers.
That was another cervical facet dysfunction where, just kind of chronic pain, difficulty sleeping, and the percutaneous pads really turned things around for him.
Glad to hear that. Kind of as a follow-up, how long would you say your talent experiences pain relief following the BioWave treatment?
Again, it kind of depends on what the injury is. It depends on how long the treatment is. The majority of the BioWaves, I believe, and correct me if I'm wrong, Brad, but they're programmed for basically a 30-minute treatment.
Correct.
So if you run the full 30-minute treatment, the majority of the time you're going to see several hours of pain control effects. And again, like I said during the presentation, we are seeing some compounding effects too. So we use it pre-practice, we use it post-practice, we use it beginning of the day, we use it end of the day. And a lot of times those pain control effects will carry over into the next day. Eventually getting to a point where we don't need to use it as much to continue to do rehab and continue to progress.
Another question is, how many times a day did you use BioWave for the gastroc strain individual?
I believe this was a while ago. I believe we used it once a day, pre-activity in the athletic training room. So he would come into the athletic training room. We would put the BioWave on him and a hot pack just to make him feel good. Before we would start rehab, let that run for 20 to 30 minutes, depending on the day and how much time we had. And then when he would get home at night, when he's sitting, hanging out, watching TV at night, he would put the calf wrap on and run that anywhere from, a 30-minute treatment, because we were using the BioWave Go units at the time, I'm sorry, we were using the BioWave Home unit at the time. And I believe he would run that for anywhere from 30 minutes to an hour, depending on how much time he had and how much his wife decided to bug him.
So he benefited from the combination of the compression along with the much larger size area electrodes that are built into that calf biowrap.
Very much so. Very much so. And that was I believe he was the first person we started using the percutaneous pads on as well. He wasn't a fan of the percutaneous pads, but I think that was more just him being him. There is a slightly different sensation with the percutaneous pads compared to the regular off the shelf. So you may have some athletes that like the percutaneous pads, you may have some that don't. But either way, we were able to get the effect we needed without using them. So.
What was the biggest challenge for you in your transition from being an athletic trainer in college to a professional athletic trainer in the WWE?
I think the biggest challenge for me was I gained 20 to 30 hours a day and I didn't know what to do with it. No, honestly, it was definitely a fun transition for me because, I spent 15 years between college football, college baseball, and the opportunity to be a husband, be a dad, be around for my kids a lot more, but still work with high-level athletes and travel the world was pretty cool. In my first 6 months with WWE, I was in Toronto, I was in the UK 3 different times, I was in Norway. I think I traveled to 18 states in 3.5 months or something like that. So it's been a lot of fun. It's definitely been a lot of fun.
Sounds great. So that's all we have in terms of questions, unless anybody else has another question they want to submit. So Chris, I want to thank you very much for your time. This was a great presentation, and I'm sure we'll talk soon.
Sounds good. Thank you guys. I appreciate the opportunity.
Our pleasure.